They should be encouraging more people to be treated at home.
More care in the home, if it can be treated, is a wonderful idea because they're in their own environment.
For those who can be cared for at home within the community, I think that one will also work as well.
I think you have to have lots of very small satellites all over the place where people don't have to travel a long way to get to them.
We're reviewing the way we deliver our services, and we're doing that by going back to the highest clinical standards, which will produce the best outcome for patients.
We treat a wide variety of conditions, ranging from clinical conditions such as chronic obstructive pulmonary disease, heart failure, chest infections. For us, it's really the ideal scenario in which to treat a patient, because you get to see somebody in their natural environment as such, where you can see a true picture of how they're really coping and how they're really feeling.
The philosophy of small dedicated services aimed at those people who have intense needs, I believe, leads to a greater recovery of the individual in the longer run.
I think the benefits of a practice like this are the fact that they have lots of services under one roof.
I've never had to wait for an appointment, and everyone's always very friendly and approachable, so I quite like it.
A patient can come in, have their consultation. They've got a lot of services in the same building.
The waiting times are less here than at the hospital, I've always found. And it's just so much easier to come here rather than to the hospital.
I think for most, probably 90% of the services that hospitals offer, you don't need to be in a tertiary central London hospital for the services that people need. They can be offered more locally.
We are exploring the possibility in North West London about developing an informal partnership between the acute trust, the hospitals, community services, social care and GPs for delivering the very highest care for patients.
I think the big idea is to actually apply standards and have these standards at world-class level so that our patients can receive the best care. The idea is to collaborate more, to work together more, to provide care that's accessible 24 hours a day, and also is very, very patient-centred.
We have some very good NHS services in the area. In some cases we have world-class services. But the trouble is it's uneven.
It wasn't a long wait at all. It was a very short one, and I was sent straight away up to the acute heart assessment ward. And they found a bed for me immediately, and the process took much quicker than I'd anticipated, or that I'd had before even. It was very good indeed.
She didn't get proper care, and she's been waiting for the operation for nearly 4 months now.
I prefer going to a hospital where everything is efficiently under one roof.
There's certainly a need for change in North West London because the current model of delivery isn't sustainable, it's not safe for patients. So we know if we go into some hospitals, there aren't enough surgeons to produce the best care for them, and we would get much better outcomes if we centralise surgery in particular. And that will, as well as being better care, will have to be cheaper care, and in a climate where we have very constrained economics, being able to do something better and cheaper is something that's a bit of a no-brainer, really.
I think for those people who really are very wedded to their local hospital, if their local hospital is a centre of expertise, then they're very lucky. If their local hospital is not a centre of expertise, I would ask them not what they want for themselves, because you become very personal about what your travel requirements are, but what they would want for their parents. And that becomes a very different question. Would you like your parents to be treated where the expertise may be not quite as available, maybe not quite as technical, or would you like them to travel, and we are talking about London here, another 20 minutes in the ambulance and get to a centre where there's a lot of expertise available 24/7?
The reason they come to this centre is because we have all the services that they possibly will require being in a polytrauma situation. So that means that if they come in and they've got orthopaedic issues, neuro issues, cardiothoracic issues, we have all them services available to us 24/7, 7 days a week.
I was born in northwest London. I was brought up in northwest London. My children and my grandchildren were born in northwest London. My elderly mother lives in northwest London and is able to stay at home and be independent because of health and social care working together. I want that good experience that I've had of healthcare in northwest London available to all.
As a GP caring for people in the health system, I'm an ardent believer in the NHS. I think we have a real opportunity to improve the care of our patients, to produce a sustainable system that will improve care as well as be affordable as we go into the future.
Nothing stays still in life. Everything changes around us, and healthcare is no different. We need to make sure it changes for the good.